Good morning. My name is Tony Gallo, and it's nice to be here. Nice to see you. First off, I want to tell you how I appreciate all the things that you guys do. I know that you guys take the extra effort to bring us the organic food and all the things that you do, so we appreciate that. Because anything that has to do with health, I'm all for it. So, this morning what we're going to do a lot of things with exercise. And so a lot of the common things that I see with exercise is the lack of recovery, because that's why they come to see me. It's not so much they come to see me for the prevention. They may come for me, they think they're going to have the strengthening, but they usually come for me for the recovery. So that's why I had to have the tennis balls. And so this slide here is not quite correct in terms of our hospital has just merged. I'm with Grinnell Regional Medical Center, but we just merged with Unity Point, so I'm with Unity Point Grinnell Regional Medical Center now. So what we're going to do this morning then is I'm going to go ahead and show this next slide here. And I put this YouTube slide up here because I want to put this disclaimer out there for everybody. If you have any issues, like if you have just had surgery or if you've got ongoing osteoporosis, osteopenia, if you've had hernia surgery in the past, some of these things that we do might not be quite what you need to have right this moment. So use some discretion with that. A lot of these exercises too, I don't prescribe for everybody. But I wanted to give you a good rounded exercise program to kind of look over and see what you kind of like and what you can pick and choose from. So what we're going to do at first off is we're going to talk just briefly on what is recovery. And so for recovery, with you folks, if you're farming and you're raising some of your crops you have to recover the land, the nutrients into the land, so that the next year that they are able to go ahead and give you a productive yield. That's what we're going to do here this morning. We're going to recover our bodies so that your bodies can be able to regenerate and be able to produce whatever it is you need to do the next day. And this is why people come in to see me, is because they haven't recovered. And so I spend most of my time teaching them how to recover. And so I just put this picture in here of this field to remind you that sometimes during the harvest you see your production, but during the off-season, like now, it's very dormant. But if you've done your work right, which don't ask me to repeat it because I don't know anything about your job, but if you've done your job right, your fields are now getting nutrients into them so they're prepared for next year. Okay, so when you came into the door, what I did was I gave you a handout and you had a tennis ball. So, what I want you to do, if you came with somebody, great. Someone that can take notes, and you can go ahead and participate in the exercises. Okay? The exercises I'm going to give you are recovery exercises, so they're not super intense. So you see some of the strengthening exercises, and sometimes that can be a little intimidating for some. You will not be doing those, all right? You will be doing the exercises a little bit low-key. So what I want you to do for me right now is to come on up with your tennis ball, if you choose to do so, and come around and just kind of circle around here. And we're going to go through a warm-up. So I'm going to have you take your shoes off. Socks are fine. Socks are fine. Take your tennis ball and come right around here. I want this to be interactive. I want you to be able to learn. If you don't have a tennis ball and you want one, there's some in the back, in that box. You may use a tennis ball, but I like using these lacrosse balls. These lacrosse balls last forever. Okay, the tennis balls, once the compression goes out of them, they don't last as long. But if you have issues with your feet, like arthritis or any problems, okay, then the tennis ball might be a better choice for you. The other thing you have to consider too is the ground that you're on and how hard it is. The carpet here is piled, so If it were more cushy and had a better cushion, that would be another reason why you might want to go on something a little more firm. So as long as we're on the feet, because that is on the very basic foundation that you have. So since we're on the feet, we might as well talk about shoes for just a brief moment. And so if you notice the shoes that I have, they were just laughing at them before because when I took them off, they just like folded and fell. There was nothing to them. They're very minimalist. And I like to use the minimalist shoe when I am doing any kind of lifting or kind of exercising that we're going to be doing in a few minutes. And the reason is because I get a lot of feedback into my feet, a stimulus. So put the ball on the floor, and you're just going to start to roll the ball from the ball of your foot to the front of your heel. And the amount of pressure that you put on there could vary from person to person. If you want a ball, you can go back and get one if you want to participate. Okay? Some of you may have plantar fasciitis. And if you don't have it, then a lot of people probably are really close to getting it because I see a lot of it in a lot of people that don't even know they have it. So if you have an acute case of plantar fasciitis, then I would not recommend doing this because if you did it, do it very softly. Now the amount of pressure that you want to put is going to be not to the point where you feel like you're going to break any bones or your blood vessels, but you do want to have some area of discomfort. And so you're looking for areas that are tender. And then what you'll do is you just go ahead, and once I find some areas that are tender, I'll go ahead and put a little pressure there. And mine is always on the inside. And I might even go ahead and contort my body just a little bit. Okay? And then I'm going to put my heel down on the ground, right? And I'm going to go ahead and take my hand, I'm going to reach up. I might even put just a little bit of arch. I don't have to. If I get in this position right here, I'm good. But if I want, and I'm safe with it, okay, if I don't have any back surgeries and other things we talked about, I'm going to go put just a little bit of an arch, and I'm just going to rotate a little bit. And I can feel that in the back of my calf. Okay? So good morning to those calves. Right? Come back. Then I can kind of come forward to the toe. And I can come back and I can put the ball on the back or the front of my heel. Right? And I can kind of, like I got high heels on, and I'm going to take it and I'm going to go roll back and forth like this. I can put it out a cigarette. And I'm putting pressure and I'm looking for areas that are tight because that plantar fascia is going to attach right into that heel. Okay? And I'm just going to go ahead and squash it out. And however much weight I put into it, I can do whatever. Okay, so we're going to go switch over to the foot because we want to be balanced. And we're going to start off rolling again. Now, some of you might work in the fields, so I'm thinking maybe you wear steel-toe shoes, maybe you wear boots, all right? That is like wearing a cast, a semi-cast. These are minimalist shoes. So these minimalist shoes give me all kinds of feedback. When you're wearing boots, you get less feedback because it holds your ankle very stiffly. So if you have that issue and you say, well, I go to work, I've got to wear the boots. I hear you. I have a lot of patients say that. That just means that these exercises that we're showing you with your feet are that much more important. Because every day you're kind of in a cast for whatever, how many hours you're working, 8, 10, 12 hours. So you need to kind of give your feet some TLC. Okay, so we'll go ahead now. I'm going to go ahead and put on my heel. I'm going to go back and forth. Okay, and then I'm going to come here, put my hand above my head, arch my back just gently if I need to, if I want to. Then I can go ahead and rotate. I like this because it's just not a calf stretch. You're using your entire body, you're getting a fascial stretch all the way throughout. Okay, great. Now, what we're going to do then is this. When you go home, you're going to wonder, am I doing the right things? What can I do? So I'm going to give you a barometer to use. And this barometer is going to be where you're going to have your feet together. You're going to have your knees here. And you're just going to take your knees and you're going to go like this. This is almost like you're skiing. Yeah. and you're going to go both ways. And you're really trying to feel where you can and where you can't move. Is it tough going one direction? Is it easier going the other direction? Do I feel at my ankle? Okay. So you keep checking that every so often. So now what we're going to do, I would normally do this against the wall. And so if you have someone next to you, you feel that you can put your hand on their shoulders, you can do this. But we're always so used to staying on our feet, so our feet are always in this position. So what we want to do is we want to get our feet out of this position. We get in bed, what happens? Our feet are like this, and the blankets come up, and they pull our feet up like this, and so we're in this position, and sometimes that's not very comfortable. Or if we lay in bed, our feet are stiff, and we lay on our stomach, and that's not comfortable, so we put our feet over the edge of the bed, and that's comfortable. So we have to get out of that position a little bit, and to do that, what you're going to do is you don't have to have one of these. You're going to take your foot and go in the opposite direction, like a spatula. Now, sometimes your foot is so stiff that it's like, not a spatula, it's like your toes are going into the ground. So you have to be careful with that. So you need to do a lot of ball rolling to get that arch more mobile so that you can get a spatula. So with this, you have to be kind of careful. So if you have any kind of arthritis to your feet, just be careful with it. That's why I like these shoes too, because I can do these exercises with these shoes on. You would do these exercises normally with no shoes, barefoot. So what you're going to do is you're going to be in this position here. And we call this a toe pull. So what you're going to feel is you're going to have your foot in a spatula position, okay, like this. And you're going to go ahead and just kind of put it there. You're going to feel that pull in the front of your ankle. And you're just going to give a little bit of an oscillation to kind of loosen that up. Again, if I wanted to, I could go over my head, and I could add a little bit more into that, but I want you just to focus on the ankle joint itself. So then I'm going to move the ankle about 6 inches, the foot out about 6 inches, and I'm just going to let it fall in. And you might feel your feet cramping. All right? That's how tight that is. So I've never had anybody that had the cramps persist. Okay? So again, now the next move, so there's 3 positions: straight, out to the side, and over this way. Okay? Yeah, like you're trying to sprain it. Mm-hmm. But please, refrain from any sprains. All right? You may jump in at any time here if you'd like. You may exercise with us. You don't have to if you don't feel an urge. Okay? So go ahead and relax. So now we'll go ahead and go to the other side. So we'll go to the other side. And we'll do the same thing. And you've already got it on stretch, so it doesn't have to go very far. All right? Now, whenever I give you any of these exercises, balance is paramount. So if you're kind of feeling like you're losing your balance and you're kind of having this, I've had people that come in that are 60 years and they're over. They come in, maybe their balance is a little bit more impaired. Put the wall right there, and they can still do it. We don't want to have this going on because then your nervous system thinks that's what you're trying to teach it. And it's like eating junk food into your nervous system, giving it bad information. So then you go ahead and come out to the side, 6 inches. 5 to 10 oscillations, usually pretty good. People ask me how long should I work on this. In 5 to 10 reps, if you want to just get going for the day. Come in here, and you're just going to come in here like this. Get that ankle to start moving just a little bit. Now you don't have to put it over here like this. Okay? We'll get there in just a second. Okay? And then just put it there. And just kind of feel the outside of your ankle loosening up just a little bit. Okay? So just kind of shake it out a little bit. I like to just kind of I feel my ankles pop and creak. So I'm going to go back to my barometer. I want to see where am I at? How does it feel? So I'm going to go like this. I'm like, whoa, okay, I feel a little more giddy because my ankles are starting to move now. Okay? Now, if you're not feeling giddy, don't feel bad because number 1, you might have some tension in your ankles. Number 2, you might have some tension in your hips. So the knee itself is not a very intelligent knee joint. It has 2 bosses. It listens to your ankles, whatever it tells it to do, And then it also listens to your hip, whatever it tells it to do. So it's kind of doesn't have really a chance to do anything on its own. So what we're going to do next now is we're going to go then to the hips. And so we want to see what kind of effect the hips have. Now I'm going to go ahead and show you some hip exercises. But since I don't have enough of these balls, all right, I'm going to give you an alternative stretch while I'm stretching with Liz here. With these balls, now again, if you have any kind of problems with, I guess I should use my presentation. I brought that, didn't I? Okay, so there's the foot and the calf. As you can see, the calf, or the heel right down here, okay? That is very important because that's like a rudder, and it has to move. And if it doesn't move, then you're going to have repetitive trauma that's going up your leg every time you step. So if it's stiff, and we got issues. So that's why your feet are so important. People say, my hip hurts, but I don't understand why. I didn't fall or anything. A lot of times I go down to the feet, and that's where it's coming from. And vice versa. If I got hip problems, I'll look at or foot problems, sometimes the hip or whatever it may be, either way. Okay, so look at the hip, and we look at all the musculature. There's a lot of muscles attached, and it's very thick, very meaty. And over here where the pointer's on, that's your tailbone. That's half of it. So you notice that if you got anything wrong with your lower back, if you got hip muscles here that are having problems, you're going to have problems with this SI joint, or your hip, and your tailbone here. And your hip bone is actually over here. All right? So it's a pretty important thing.
Which is the SI joint?
The SI joint is where this tailbone is right here. Okay, so the SI joint attached right up here would be your spine, sitting on top of it. And this is your nest. And think about the other half of your tailbone over here. So this would be your sacroiliac joint, which is what SI stands for. And this is your ilium right here. Okay, so that's where then the sacrum, so they attach together, so it's the SI joint. Okay? And that has to move. That has to rotate. And if it doesn't rotate, we got problems. Because we got problems at the lower back and even at the neck, because all that stuff travels up to your neck and your spine. So, now let's take this. And what you're going to do while I'm doing this is go down. If your knees can handle this. If not, you can either put your jacket underneath your knee, or there's mats that are around you can spread out so people can share. If your knees can't handle this, you're going to have your back foot flat like a spatula. Okay, and you're going to go ahead and put your toes, laces down, and you're going to press into the floor. So when you're pressing, then you're going to stay up nice and tall. Now, what you don't want to do is you don't want to go into this real deep with your knee. It's not a knee exercise. It's a hip exercise. So what you want to do is you want to let this pocket fall forward, and you want to flex your tushy to kind of press forward. Now, you notice that I'm not getting a big arch in my back. I'm not trying to do the limbo. So I'm just going to let this kind of sink in, let it press forward, and you're going to do that while Liz and I do this. I wanted to show you this. This is very effective. We're going to go around the world here. I'm going to put the ball, there's my hip bone, we're going to go right inside here. So I'm going to come here and I'm going to lay on that. My opposite leg is up like this, and I'm going to come in right in here. And I'm just going to go ahead and roll just like this. I'm on my elbows. All right? I love being on the floor because as we get older, how much time do we spend on the floor? Right? It's like floor gymnastics. And my nieces and nephews come down here like, oh yeah, let's play. He's got the balls, let's go. All right? So unfortunately, the dog comes too. Right? So you're going to roll up and down, and you're going to come to underneath your rib cage. And you're just going to like settle right in here. You have fibers that come off that hip flexor that go into your diaphragm. And it almost takes my breath away just a little bit because it's sitting right on my diaphragm. And so I'll just go ahead and roll that back and forth. Now I'll even come out to my thigh and get that. A lot of you have seen this with the mob rolls or the foam rollers, right? The tennis balls you have are too small to do this. Go ahead and switch legs. If you haven't switched legs, go ahead and switch legs and do the other leg. Okay? So So now Liz and I are going to go ahead and go over to the side. So when we go to the side, I'm in this position like this. All I got to do is just take this arm, post this one over here, lift this leg up, and here I am. And there I go. So we're going to get that IT band that some of you have already heard about, especially if you run. And now I'm going to go around the world again. So now we're going to go back to that SI joint because we're going to get all of that beefy musculature back there. So now I'm just going to roll and I'm going to sit. I have my leg turned out just like this. Okay? And I'm going to roll back and forth. And I'm going to expose, I'm going to turn just a little bit if I have to, just kind of expose some of those muscles around my hip. And then you're going to go around the world the other side, so you're going to bring the ball over to the other cheek, turn your foot out, and you're going to go roll up there. You know what these balls are? These are balls that you put the treat in the middle for the dog. Okay? You have a sky ball. I got that from Amazon.com. But that is an old dog ball, all right? It's hardened. I like it firm and hard, so because I've been doing it for a while, so I use that. Okay? You do have the soft one. Not that you're soft. She's soft. Okay, so now I'm going to the outside here. And then I'm going to come this way and go front, forwards. I'm losing my microphone, so I won't do this side because I will smash my microphone. Okay? So what you're going to do now for me while she's still doing that is you're going to go ahead now and we're going to put you, for some of you who've been in yoga, pigeon pose. So you're going to come down, all right? You're going to put yourself in this position. If you want to do the pigeon pose, you may. That's also going to pull those muscles that go to the SI. Okay? Now, one thing I wanted to tell you about exercise is this. It is an exercise not only in physical prowess, but it's an exercise in humility. And it is an exercise in humility in terms of what your flexibility is, but also knowing when to stop, knowing what your limitations are.
Do you have replaced knees?
Replaced knees would be kind of tough. So I would say with the replaced knee, you can do it this way. So you can kind of get this stretch in this way. It's a little bit harder because now you got to use your arms. And I would say also kind of, you may even kind of put your knee up like this to kind of help stretch out a little bit more. Okay, give you time to go ahead and do that and stretch out the other side. When you go into pigeon, some people will start out like this. All right? That's okay. When you go into the pigeon, they'll start to have you start to go a little bit further as you get more flexible to get it out this way. All right? To get a little bit different angle of a stretch. The key of the pigeon, in my opinion, is this. It's the torque in the hips. So if you can kind of like just torque your hips just a little bit, it's like, wow, a little bit of bang, you get a lot for your buck when you just torque your hips and drop this hip over here down. You really get that. Okay? It really pulls on your bottom. Now, again, I want to caution you about limitations because any one of us could be walking around with a disc problem. All right? So any one of us could be walking around with a disc problem. So we have to be aware of that. Because I could have one right now and not know it. I could be symptom-free. Okay? This is a picture right here of the hip flexor. You can see how it attaches into the spine. So it goes from the front of your leg, goes underneath your plumbing, okay? Goes underneath the diaphragm and attaches to your spine there. As you can see, when it becomes tight, it can be very problematic. What you'll see with people like that is they can't lay down with their legs straight. They gotta sleep in a fetal position. Getting out of a car, getting in and out is hard because their hip flexors are so tight. So it feels better to have it up like this. You also see them having difficulty going up and down stairs. That's a problem. So, okay. Now, the next thing we're going to do then is we're going to go ahead and I want to try to introduce a lot of things to you. So we're going to bring this foam roll out. A lot of you have probably seen this before. And just sit on the very end. I like the long ones. I don't like the ones with the knobs on them. I like the long ones. Flat. And I'm just going to lay flat like this. This is a great position because I give this to people and like, this is my therapy? I go, yes. They're like, yes. So what I do then is this position, I lay here because I want to reverse the effects that I do every day. I kind of type there for how many hours. I'm working on patients, how many hours bent over. So I want to kind of reverse that effect as much as I can. And then I'm going to go ahead and just kind of just slide side to side. I want to keep myself parallel to the floor, have my feet apart, and I'm just trying to kind of work out these muscles a little bit. Everything we're doing so far in recovery, with the exception of a few things, has been passive. You're laying here. It's almost like you're massaging your muscles. So I don't want it to be all passive, but I know that if I want to recover my muscles, I have to decrease that tonic sense of tightness. And to do that, I might have to do something passive. So I just kind of roll side to side. Now, I will take this out. Okay, somebody used this before, like this way. I'm going to put this behind my head. And I'm just going to, you can raise your bottom if you'd like. You can come up. I don't like to come down to my lower back. I mean, I can, but it just puts a little bit too much stress on my lower back, so I keep it to my shoulder blades. All right. Now I'll drop my hip down, and I'll rotate back and forth. And I want to get in here. I want to get into my lats. And I'll just kind of rotate in through here. And I can kind of picture my lats there, and I'll show you. The lats are on the, it's that muscle that goes all the way down to your lower back from your shoulder. So you can see what an effect that would have on the left-hand side of your screen there. You can see what an effect that would have on your lower back. So I'll come all the way and go through the rib cage there. And I'll come through the other side. How high do I lift my hip? Whatever I can handle. The lower I have it, the less pressure there is. The higher I raise it, the more pressure there is. Oh, yes. Now these are 3 feet long. They're 6 inch in diameter. And they come in various colors. Usually the ones I look for are like white or black. And the reason the difference of the two is that the black is more firm. When I get a black one, it's going to last forever. I get a white one in the clinic. You know, we see a lot of people, so the clinic, we probably get a new one about once a year because it'll deform a little bit quicker. But some people, if they have like issues of osteoporosis or any kind of, if they're getting up in their ages where they're getting close to that, then the white one might be the way to go. Also the size of the person, if they're a very big person, probably the firmer mold roll will probably be the better one to get. I don't like the one with knobs on it. You see those? Those are trying to hit pressure points, try to deliver a little bit more. That's why I use the balls. Okay? I use the balls because the balls can get in there and I can roll on the balls. With the knobs on here, I can't roll. You know, they're going to be in the way. So these here, foam roller. Yeah, if you just Google foam roller, these will pop up all over the place. I would expect you to probably, you know, spend $20 for it. Bless you. Now the other thing, let's see, where did I put my bag? My little bag. Did I? St. Benedict? No. St. Benedict. All right. Nope. That's okay. It's around here somewhere. No, just my St. Benedict bag. That's okay. We're good. Is it there? Okay. So people say, well, why don't you get this, and then why do you have all the balls and stuff? How many of you travel? Okay, I think everybody probably travels at some point in time. I got this, I got this, I got this, I got this. Okay, I'm ready to travel. Put it in your bag, put it over your shoulder. My kids are like, Dad, are you going to do that thing again where you pull out all those balls in front of everybody? It's like, I'm old, I'm stiff, I got to move. And that's what the thing is. We've got to keep moving because the more we can move, the younger you are. How many felt better after doing some of the knee things after the second time around? Okay. You are now approximately 5 to 10 minutes younger, right? Because you're moving better. You're moving better. And then when you don't move well, we age faster. So that's why I always go to a conference and I always grab these bags because I always want them to carry my stuff in. Okay. So now what we've done is we've done a lot of the exercises for the hips and the knees. So go ahead and stand on up again. Please. Had a patient one time come in to me and she said, I remember I first started therapy and she said to me, I'm a little bit nervous about this. I said, I don't like telling people what to do. She said, well, that's why we come to you. She said, we want you to tell us what to do. I said, okay. So I started telling her what to do. And then the next minute she rolls around and she says, you do mean please, don't you? I said, yes. Yes, please roll over. Please lie down. Please. So please get up. And now I want you to go through your motion again with your knees. And I want you just to feel what that's like. Okay? Hopefully you're moving a little bit better. You got through the hips. Okay? Now, when you do this motion with your knees, is make sure it's knee motion. Okay? I look out and I see some are kind of like, it's like you're doing the hula hoop, all right? So make sure that's not where your knees are going way around. It's my knees, so I can isolate. Is my ankle moving today? If not, I better do something, right? So, okay, so now let's incorporate all that we've done so far. So what we have to do then is we have to then put our foot like this. We talked about before about doing this, right? And we oscillated. So now let's integrate what we've done so far. So bring this foot over here like this. It requires some balance. Again, if you need a chair or wall for balance, that's fine. So we talked about our lats. We talked about all this fascia connection going from, so we're going to have our foot like this on its side, and we're just going to reach. Get that hip to go to the left. I'm using this, and I'm just going to go back and forth. I'm going to make it dynamic because I've already done something passive. I already massaged it. I want to use that word, okay? And I want to do something dynamic and switch. Yep, go to the side. So I do something dynamic. I'm incorporating everything that I've done so far, right? And I'll alternate. Just kind of getting some movement into my body. Movement patterns. Making your body do something rather than just, okay? This isn't going to cut it if I'm a three-dimensional individual. Okay? I want my freedom. Give me my 6 degrees of freedom. So I want all of it. Okay? So, now, I know a lot of you do a lot of lifting. So what we're going to do is show you some things that you can do for your arms and shoulders a little bit. So with this, is I take this and I can put it right here on my neck. I can just kind of like roll back and forth, just roll my neck back and forth. Am I okay? Okay. That's not for everyone else to answer. Okay. Okay. So then, this is one of my own little inventions here. And I remember back when I was in junior high, and I was always nervous on my first date, And so I developed this Mr. Smooth move. You know, you're kind of like in the movies, and you're kind of like, oh, I'm tired. And you just kind of put your arm right around your date, right? And what I'm going to do is this. I want my head to rest. I'm at a little bit of an angle, and I want my head to rest. And I have my arm on this part of the roll here. And my target area is going to be the back of my shoulders because I carry so much tension back there. We all carry a lot of tension. Have you ever noticed if you have a stressful day, you have a lot of tension back here? So what I'm going to do then is I'm going to go ahead, I'm going to take this, and I'm going to put this leg down so I can put more pressure towards this left back posterior shoulder. And then I'm just going to go ahead and roll it back and forth. And I might even put a little bit of a stretch into it to expose that muscle, and I'll roll up and down.
Is this like giving yourself a massage?
Kind of. You're exactly right. Because we hold ourselves in a tonic position. Okay? So what I mean by tonic is this. I had a person one time come in and I said, what'd you do this today? Oh, my back's hurting more, you know? And I go, well, why is that? And it's like, oh, did you do anything? No, I just went to work. And I go, what'd you do at work? I just stood there. I just cashiered. So I said to her, you're using those muscles to stand. You're using the muscles to balance yourself. And so you're holding them just like this for 8 to 10, 12 hours. So imagine if you had to unload a truck for, 20, 30 minutes, and you're having to hold yourself tonically and lift. You're doing the same thing. Now, imagine this. A dog runs out in the street, gets hit by a car. You got to take it to the vet. Someone takes your parking spot. You got to then, it's like, you took my parking spot. Right? All those stresses accumulate. So not only are you having physical stresses, but now you're having emotional stresses, and that's going to play a part. And those will then be expressed physically. Probably not this session, but this afternoon session, what I do is some patients, I had a football player came in one time, could not get his pain to go away. Could not. So I did something with him emotionally, and it went away just like that. And what happened was, he was like the biggest kid on the team, and I came to my thought, it's like, I bet he gets challenged every day. So he gets challenged every day at practice. So then what's he do? He lines up against somebody else, and he has to take on whoever wants to challenge him, one or two guys, and he's like, and so he's creating a lot of tension, emotional tension for him, and every day at practice he does this. You can't turn it off. So, all those stresses play a part. Now, let's go to the elbows. Simple elbow exercises. All right? Just going to take your arm and you're just going to hit yourself in the face. Right? And then you're going to put your palm out because you have your fist still there. Turn your palm down. Hit yourself in the face. Come down, palms. Turn down. Hit yourself. Palm up. What you're doing is you're starting to get lubrication into this elbow. And our elbows get tight. Right? I can go the other way, right? So you're going to have palm down, palm up. Come this way. Palm down, palm up. It's just the opposite. Go to the other side. Okay? Palm up, palm down. Hit yourself. Palm up, palm down. Hit yourself. Up, down, hit yourself. By doing this motion and doing it precisely, then you're going to get more lubrication into that joint. Okay? Very simple exercise. Now, the other thing you can do is for your hands and fingers. Is because we're holding on, gripping onto crates and whatever we're doing, tools. Right? In a minute, I'll show you how to use these Kettlebells. And so I'm holding on to these Kettlebells, you're holding on. So you need something for your hands. If you're typing a lot, so what you're going to do is you're going to take your hands. Let's go ahead and do this one first. So you're just going to pretend like you're on the wall here. You've got that plaster on the wall. I'm going to step forward with this foot, and I'm going to turn, and I'm going to keep that cocked down. Right? And I'm going to rotate it through here. That's going to open this up right in through here. Okay? I could add a little bit of cervical flexion, side bending with that. And I could then kind of take my hand, rotate it. You might get a little tingling in your hand. You're getting yourself a nerve glide there. Okay, you got a little nerve glide. Okay. And then now you're going to go ahead and do the same thing coming back this way. Nerve glide. Right? Open this up. And I'm just going to take small circles. Just be careful with your necks. Okay. Good. Now, fingers. These are great. They don't seem like much. What you're going to do is this. You're going to have pinky leading the way. So you're going to take your pinkies, and the pinky goes boop, and then the fourth finger goes boop, and then the middle finger goes boop. Okay, and then you're going to come in. Now what you're going to do is you're going to rotate. So you got flexed. You're flexed so you're as far as you can go. Okay. Okay. Pinky, boom. Pinky, fourth finger, third finger, index. Okay. So it's going to be pinky. Follow the leader. Goes into flexion. Pinky comes out, sorry. Okay? Pinky comes in first. Let them go one at a time. Flex. Turn them out. Bring that pinky back, right? And you can feel your wrists just, if you're going into extreme motions, you can feel those wrists, the tension in your wrists. Okay? And I'm just going to go down. It's like, all that stuff we do all day long, right? Okay, now, same thing with your thumb. Thumb goes first. So if you're pinky, it's going to be your thumb. Thumb goes first, and you just keep on going. Thumb comes out. Thumb comes in. Flex your wrists. Extend your wrists. Okay? Thumb comes in. I'm going to flex. Okay? Thumb then comes out. I'm going to go ahead and extend. Thumb comes in. Okay? All right? Those are some excellent. Now, if it takes a while for you to catch on to that, that's okay. Not a problem. But just remember that your pinky either leads or your thumb either leads, and the rest of them follow. And you're going to go into flexion or extension. Okay. Now, this next one, I'm going to go solo, but it's not a big deal. Okay? So, what I want to do is just quickly show you what I would do at home. So, I'm going to go down and I'm going to do my ball rolling, right? I'm going to go down to here. So I'm going to come over to here, right? I'm going to come over to here, right? I'm going to come over to here. I would spend a little bit more time than this on it. Come over to here, right? Come over to here. Up. Sorry, I'm going to come back over to here. Okay, so I would then come up through my stomach, right? Then I would just say, so I stay in the center of the room, I'll turn, come through here like this. Okay? Go through my back, come through up and down, get through the same motions. Okay? Come back, hit my arms. Okay, I can then come back, go through my back again, go on my back, come through the other side. So, someone mentioned massage. Now we've taken it towards more of an active type of thing, right? So you're getting that floor gymnastics. Okay. So, let's go ahead and come on out. We're going to go ahead. We only got one of those. So you're laying your back front, please. Abdominals. No, you're going to take that and put that, lie on your back. So with that, you can use any kind of foam. Put your one knee up. I don't care which one it is. So she chose that knee. So that tells me what hand it's going to go in. So she chose the knee, so that's going to go in that hand. You're going to put it against this knee, bring that knee towards your chest. And then what you're going to do is you're going to go ahead and press gently and do an isometric. Just hold it. Put your left arm over your head straight, off the floor, off the floor. This leg's going to be straight too, and it'll just be off the floor. Okay, now she's going to turn her head and she's going to rotate, and you're going to follow your head and rotate. Okay? It's a great... Now with that, she's doing a great job. You want to keep your arms and legs off the floor. Everybody wants to rest on their elbow when they're rolling, right? But it's great integration of using your whole torso. And it activates your pelvis. So you're pushing here, right? So you're activating. Your hand could do the same thing, but that just means you'd have to rotate a little bit further. Okay, for some people, they need a little something to, I will use even a package of paper towels that work sometimes. Turn your head the other way, go the other way. And then obviously, you're going to reverse it and do the other way. You may try it. I don't know if there's enough room for everyone to try it. Okay. The first few reps you do it, it's like, oh, God, you're like all over. She's doing pretty well. So the first reps you do, go ahead and relax. And so then you do with that is that the first few reps you're kind of shaky. And then after you get better and better with it because you're giving yourself good information to your nervous system. You're engaging that core. You're put in a position where balance isn't an issue where you're fear of falling. Some of the exercises you do with your core, you're afraid of falling. Okay? Okay, great. Now, go ahead and stand up for me, Liz. So now we're going to go ahead and go to these. And what these are kettlebells. So, normally what I'll do with a strengthening thing is I'll go to my resistive tubing. For some people who have surgery, I'll be safe with them, do the resistive tubing. The thing about the resistive tubing is it fires your stabilizers in your shoulders, gets those kind of firing. And then you do it real slow. So if I can do shoulder strengthening or anything with my appendages, I can do it really super slow and get a nice stabilizing effect into my joints if I have a faulty joint. So, a body weight exercise. So we just did a body weight exercise there. Body weight exercises are excellent. So if you're looking to get into shape, recover first. Go into body weight exercises if you can. Tolerate them. Simple. The simpler the better. You don't want to put yourself in a situation where you become harmed by your exercise program. I know there's this new thing out, CrossFit, and everybody's encouraged to join in it, but you've got to go in where your level is, your comfort level is, and be honest with yourself. So now with this, what you're going to do with this, the thing about these is they're round. And so the amount of center of the gravity is, the center of the mass is dispersed in a round way, so it's kind of hard to hold on to. Whereas if you have a dumbbell, it's easy. There's a little bit more stability involved with your core when you use these. So that's why I like these. So what I'm going to do with this exercise is I'm going to take this over my head, and I'm going to go ahead and do a sit-up. And I'm going to press it. Now when I do this, I'm going to come here, and I'm going to press. Come back over my head. I'm not throwing myself up, right? So it's not an arm exercise where I'm throwing myself, but I'm using my arms to accent my abs. Some people are going to say, well, can I use a dumbbell? Yes, but remember what I just explained to you about the stability. You get a little bit more bang for your buck because of this roundness, that it can go in any direction. I would say lighter the better. Now this is an 8 kilogram, so it's roughly around 16, 18 pounds. Oops, excuse me. So, now the nice thing about the kettlebells and the club bells is that whenever you use them, okay, that you're going through the whole system. You're going through the shoulder, you're going through the core, and even if I'm doing a leg exercises, and I'm going through the legs. So my glutes are firing because I want to protect my lower back. My shoulder girdle's firing because I want to protect my shoulder girdle. But there is a learning curve to it. So you have to respect that. It's that humility part again. Okay? So I can take this down. Now it's swinging. Okay? Now, here's where I love these things. I get people in these positions, right? Take these. Stay there. What is your lifting position? What should your lifting position be? What should it look like? If your exercise program does not look like your lifting position, we have a problem because you're exercising different muscles than what you're actually lifting with. The nice thing about these is they want you to have them in your torso close to your body, stabilizing your spine. What am I doing? Catching it. Remember that game you used to play as a kid? You used to toss that ball in a string and catch it in the cup? Catch it in the cup. Catch it in the cup. What do you do when you lift a box? Catch it in the cup. Catch it in the cup. Okay? Now, the nice thing about, what are we doing for time? Perfect. Okay. So the nice thing about these, I pulled out the big old King Kong there. And the reason I pulled King Kong out was because it comes in various sizes. The knob is there, so you can then create some force through this. Now, again, I can go ahead and create this, grab it by the cone here. I can bring this up here, right? So now I can go ahead, and even if I'm just doing this, I'm engaging my core. I don't have to do anything more. So I'm engaged in a good position. If I want to go ahead and engage it a little bit more, I can do this. I'm not taking my back like, I don't want to even do it with that big of a weight because it could be harmful. I'm not taking my spine over like this. I'm taking the weight and dispersing it. I'm moving the center of the mass, challenging myself a little bit more. Because what happens when we lift something out of the top of the shelf? Got a heavy box, right? And it's like, ugh. Okay? Your core has to react to that. It has to be functional. Is your exercise program functional? Or is it just filling time? Is it just filling, I got to exercise this muscle because that's what I read, and that's what somebody told me. All right? Is it functional? So, again, is it functional? I'm going to go back, and I'm just like, I'm ready to participate. I'm ready to go. Okay, I can just tell my legs are just flexible because I've gone through some of these things, even just teaching it. Now, the nice thing about this too is now I can take this center of mass and I can move it laterally. So I could take this big honking thing and I can go ahead and put two hands on it and put it right here. I'm going to load my hip, load. It's almost like you're going to hit a baseball. It's almost like you're going to hit a golf ball. Okay? And then I'm going to come out here and toss it. Okay? Push with this leg. Push. Okay? What do we do when we are hauling stuff out from the back of the pickup? Okay? Same thing. Same thing. I can do it the other side actually as well. This way. The other thing too is I can take it a step further. Is that I can go ahead now and swing this out, have it come back down here, come back into this pose where I bring it in here. Now I've got to stabilize this into my spine here. Okay? What you have to really be careful of, come on here to show me again. Do that again for me. That's okay. Okay. Okay, so you have to be careful of is you want to stay in through here. She's kind of dipping down here a little bit too low. Okay. You want to make sure your core is engaged here. You want to go low, but you want your core engaged here. Okay? And she's lacking a little bit of core engagement. I looked at her a little bit earlier before she came, and we talked about a few things with her. So I know her lack of core engagement is because she has a little bit of an issue with her hip. So it's told her hip or her core not to engage. So go home and tell your parents you're still not engaged. That's the moral of that story. Okay. All right. What else is I going to do now? Okay, so we have those. Now, take this one. This is a common one that you've probably seen or I've given to a lot of patients because it's something that's very basic. When we get up in the morning, we have to be able to get out of bed, and the first thing we do is we probably go in and close the door, and then we squat. If we can't squat, then we got problems. Okay? So, I will teach a person to get out of their chair if they have problems. Getting out. This is like people who are 75, 80, teach them how to get out of their chair properly. So, what I'll do with them then is I will take this and I will have them get their weight. A lot of them will probably sit back like this. I'll have them get their weight forward on their feet. Right? Put them in an athletic position. And then I will have them connect their elbows here. Get their weight forward. And they'll rock. Okay? If you ever want to see something cool, just take somebody who's very non-athletic and you have them do this with them, and they're like, I'm not athletic. I'm like, wow, you look athletic, okay, because they're in an athletic position. They're in a great posture. So we are all athletes. I want to tell you that right now. I don't care how old you are. And since I made you 5 minutes younger at the beginning of the session here, hopefully 10 minutes younger by now, but we're all athletes. So by having them get in that position, I can then progress them to, not directly from that to this, but with other exercises as well, is I'm going to have them reach down. I put the kettlebell out in front here, and then I have myself in a good position. I don't have my head like this, pinching back. I don't have it bent over like this. Hello. Okay. So now I'm going to have this here, and I'm just going to bring this back. I'm going to hike it between my legs. And the thing about this is the speed of bringing my hips out and thrusting because it's going to fire my glutes, which is what I want. Okay? Be careful of bending over. As people are doing this, if you got like a 30-pound weight on there and they've been doing that, like my back hurts. It's like, that hurts my back. It's because they're bending over with their lower back, okay? Not using their legs. And just to let you know, the part that my arms are playing, they're not playing much of a part. It's not an arm exercise. My arms are just going with the flow. The pendulum that's created by my hips, it's like an elephant trunk, just following the neck of the elephant. So to demonstrate that, I'm going to switch hands. Watch my legs. Legs are doing all the work. My knees, I don't want them. Now, the weight on your feet should be about mid-foot. So if you got your weight on your toes, I'm going to put my weight on my toes. Here I come. Okay? You'll know if you got any kind of sizable weight, if you got your weight not in the right place. I always kind of liken it to like water skiing. You're back here hanging out in the water ski, right? So I'm kind of here, my weight's at midfoot. But I see a lot of people, I see it go over here like this. I know they're using their arms if it's getting this high. Okay?
And if you straighten you walk your legs all the way out.
I do, because I want that connection. This is what I'm working to build, my core. And if I'm using my core to thrust the kettlebell, right? I'm not worried too much about my arms. I shouldn't be if I'm doing this exercise. Okay? Absolutely. Yes. If you have your knees going over your toes, you can't see your toes, there's a problem. You're getting too much, your knees are coming too far forward, you're putting too much stress on your knees. And your tushy should feel it after you're done. All right? That's where you should feel it. Okay? Okay. I think I'm going to do the last few minutes is go ahead and open up to any questions that you might have, or anything about anything. Does anybody have any questions about what we've covered? I think you had your hand up first.
And you'll
Pay that man $50 on your way out. Cash. Okay? Pay cash.
It'll be on the PFI YouTube channel. Okay.
Now, again, I want to put that disclaimer out there. Every person, including myself, needs a coach. Because you have that second pair of eyes. Oh, I see that your ankle's not moving. Oh, I see that your SI's not moving. Now, probably your coach at home probably can't do that, but, okay, but you do need to have a coach to say, all right, so if you go home and do these exercises, these aren't like magic exercises. They're going to make you 100% better. There are ways that you can manage and recover your body during your sessions. So like what I'll do with like some people is I'll have them exercise, whatever, they'll like do cardio, they'll do strengthening with maybe one or two body parts, and then they'll do maybe a day of cardio, then another strengthening day, another different body parts. And on the 5th day, or maybe the 6th day, depending on what their situation is, I'll say recover. And recovery, now I hope you know what we've done today, doesn't mean sitting around watching TV and getting caught up on Netflix. All right? That's not recovery. Although I do watch Netflix with my recovery. So I'm doing my ball rolling and I'll be watching Netflix, okay? But you need to have that at least one day of recovery. Now, if you have a lot of recovery to do because you haven't done any ever, or you're getting in that age like I am, I do more recovery now as I'm getting older than I do at actually strengthening. So that tells you how important recovery is because I want to become younger as quickly as possible, or as long as possible. So I know that the exercise is important. Movement is important. I had some other questions over here.
When you're talking about shoes, what do you, like in terms of ankle support, is it just a matter of also strengthening and stuff? Is that what you're saying?
Yes. Yeah. So with shoes, everybody has different kinds of feet. But usually what I'd say is this. If you go with a thicker shoe on top, you don't want like super thick, but usually people who have problems is because they have a lot of tension in the back of their gastroc, in the back of their calf. So that tension is there, so by giving them just a little bit of lift and with a thicker sole shoe, then you, thank you, and please. Then with that thicker sole shoe, you can kind of take some of the stress off that gastroc a little bit. So this is about, it's not really super thick, right? But what I like about this shoe, these shoes, is I love the Nike Frees. The reason I like them, because I told you, I like to have my 6 degrees of freedom. I don't like to be told that I can only do this or do that. I want to be active. And so, right, there's 6 degrees of freedom, right? Give me that one that's right there, that's back there. No. That one right there. I didn't realize this is a trail shoe, and these trail shoes are a little bit firmer. I'll show you the difference. Okay. Where does it bend? One spot. Is that free? It's not free. Right? This is pretty good, though, for a trail shoe. This is pretty good.
But is it true, like, if you're strengthening the mobility of your ankle, you could potentially have less injury, even with a shoe that doesn't cover your ankle to protect it because your ankle is more flexible?
You could strengthen it to a certain degree, okay? But what else is going to control that ankle for you? What else did we say? Your hip. So if you strengthen that hip and you're stronger through your pelvis and your pelvis is balanced and you got that strength, your balance is going to improve. Okay? And I never had this balance before, okay? Because my martial art instructor, he'd look at me and kind of like, yeah, he wasn't too impressed at first. But the thing about the shoe is you want to make sure that it moves. Now, the shoe isn't magic. It's like, oh, I got these Nike Frees. I'm going to be like pain-free. What's magic? The magic is the exercise that you do to have that freedom. It's just like our freedom in this country. Just because we have freedom doesn't mean it's going to be exercised in the right way. Okay? So, what we have to do is we have to do the exercises. People have mentioned orthotics. So if I've got more, it's just like anything else. You tell your kids to be well-rounded because they have more opportunities later on. If your ankle is able to move in all different directions, it has more opportunities for freedom. Yes?
I have a question about, I imagine there's a lot of vegetable growers here, and we bend over a lot. Kind of aches in my lower back.
Uh-huh.
What do you think would be the best way to recover?
If you've been bent over a lot, what I would suggest is kind of just getting on the floor, pulling your knee up to your chest a little bit, because you're going to get that stretching through your back. Heat is kind of a good thing if it's not like an acute situation where you're having a lot of pain, but if you're just kind of in a lot of discomfort just from bending over and sustaining that position. You'd be surprised by, if you're able to roll on that ball or even stretch out your hip flexors are going to be like, because you're bent over all the time, they're going to be like really shortened. All right? If I sit up, they're going to be, kind of hand me that ball, please, behind you. If I stand up, they're lengthened. If I bend over, they're shortened. So what I do sometimes, if I have some abdominal strengthening exercises, and I'm not a big abdominal strengthener because I don't want to shorten them too much to the point where they become detrimental, where they're going to pull me down even further against gravity, and then I start walking with a cane or a walker. So what I want to do is I want to do an abdominal stretch. So I'll do is take this ball, and I'll bring this, let my head rest. That's a must. If you can't rest your head on the ball, then put a pillow or a towel underneath there. Let it rest, arms go over. Extend my legs, and you're going to let the arms go over, and you're going to feel it pull in through your midsection there. And I'll rock. And again, it's not a limbo contest. It's just what's comfortable. Right? I guess one thing you have to be kind of careful of, if you have any issues with your circulatory system, had blood rushing to your head, if you have any dizziness, vertigo, that's an issue. Okay? And you just get a nice, relaxing pull in through your abs here. And people think that they always have to strengthen abs, but not stretch them. Doesn't make sense. You're using that muscle, so why wouldn't it be stretched? But
One more question, I think. Can I,
this one right here.
well, I was wondering if there are better or worse ways to bend over, like ways that are like easier to recover from.
Oh, I see. Picking green beans. Okay, so I would say this. A lot of times it depends on your situation, but I would say this, is you got a couple of variations. I like this variation, okay, where I'm kind of resting here. I could sit here almost forever, right? But now you put me in this situation, I might not be able to sit here forever. But now if you put my arms in here and I rest, I can sit here a little bit longer. My next variation would be just to come here and pick, right? Pick, pick, pick. Be in this position like this. If it's muddy, get something there that you can put down if you're worried about that situation. I don't know what you're... But I would say that, and then just kind of get yourself out. Work your hips a little bit. Change it up. Now, what that means, though, is you're putting yourself in a position, let's say you're doing it it's seasonal, because you're going to be there, you're not really conditioned to do that. So what could you do before that season comes? Okay, get yourself some squats, get yourself conditioned to do that because you know it's coming. And you're going to be, then it's only there where you're going to be hitting it hard for, whatever, a couple weeks. And then you hit it hard for a couple weeks, and then you get all your produce in, and then you're done. So that you want to recover during that time as much as you can to try and reverse some of those issues.